Fellow Nigerians, from the first signs that coronavirus or COVID-19 was turning into an epidemic and was officially declared a worldwide emergency, the federal government started planning preventive, containment, and curative measures in the event the disease hits Nigeria. The whole instruments of government are now mobilized to confront what has now become both a health emergency and an economic crisis. Nigeria, unfortunately, confirmed its first case on 27 February 2020. Since then, we have seen the number of confirmed cases rise slowly. By the morning of March 29, 2020, the total confirmed cases within Nigeria has risen to 97. Regrettably, we also had our first fatality, a former employee of PPMC who died on 23rd March 2020. Our thoughts and prayers are with his family in these very difficult times. We also pray for quick recovery for those infected and undergoing treatment. As of today, COVID-19 has no cure. Scientists around the world are working very hard to develop a vaccine. We are in touch with these institutions as they work towards a solution that will be certified by international and local medical authorities within the shortest possible time. For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus. Since the outbreak was reported in China, our government has been monitoring the situation closely and studying the various responses adopted by other countries. Indeed, the Director General of the Nigerian Center for Disease Control was one of the 10 global health leaders invited by the World Health Organization to visit China and understudy their response approach. I am personally very proud of Dr. Ihekweazu for doing this on behalf of all Nigerians. Since his return, the NCDC has been implementing numerous strategies and programs in Nigeria to ensure that the adverse impact of this virus on our country is minimized. We ask all Nigerians to support the work the Federal Ministry of Health and NCDC are doing, led by the Presidential Task Force. Although we have adopted strategies used globally, our implementation programs have been tailored to reflect our local realities. In Nigeria, we are taking a two-step approach. First, to protect the lives of our fellow Nigerians and residents living here, and second, to preserve the livelihoods of workers and business owners to ensure their families get through this very difficult time in dignity and with hope and peace of mind. To date, we have introduced healthcare measures, border security, fiscal and monetary policies in our response. We shall continue to do so as the situation unfolds. Some of these measures will surely cause major inconveniences to many citizens. But these are sacrifices we should all be willing and ready to make for the greater good of our country. In Nigeria's fight against COVID-19, there is no such thing as an overreaction or an underreaction. It is all about the right reaction by the right agencies and trained experts. Accordingly, as a government, we will continue to rely on guidance of our medical professionals and experts at the Ministry of Health, NCDC, and other relevant agencies through this difficult time. I therefore urge all students to adhere to their guidelines as they are released from time to time. As we are all aware, Lagos and Abuja have the majority of confirmed cases in Nigeria. Our focus, therefore, remains to urgently and drastically contain these cases and to support other states and regions in the best way we can. This is why we provided an initial intervention of 15 billion naira to support the national response as we fight to contain and control the spread. We also created a presidential task force to develop a workable national response strategy that is being reviewed on a daily basis as the requirements change. This strategy takes international best practices but adopts them to suit our unique local circumstances. Our goal is to ensure all states have the right support and manpower to respond immediately. So far in Lagos and Abuja, we have recruited hundreds of ad hoc staff to man all our call centers and support our tracing and testing efforts. I also requested through the Nigerian Governors Forum for all state governments to nominate doctors and nurses who will be trained by the NCDC and Lagos state government on tactical and operational response to the virus in case it spreads to other states. This training will also include medical representatives from our armed forces, paramilitary and security and intelligence agencies. As a nation, our response must be guided, systematic, and professional. There is a need for consistency across the nation. All inconsistencies in policy guidelines between federal and state agencies will be eliminated. As I mentioned earlier, as at this morning, we have 97 confirmed cases. Majority of these are in Lagos and Abuja. All the confirmed cases are getting the necessary medical care. Our agencies are currently working hard to identify cases and people these patients have been in contact with. The few confirmed cases outside Lagos and Abuja are linked to persons who have traveled from these centers. We are therefore working to ensure such interstate and interstate movements are restricted to prevent further spread. Based on the advice of the Federal Ministry of Health and the NCDC, I am directing the cessation of all movements in Lagos and the FCT for an initial period of 14 days with effect from 11 p.m. on Monday, 30th March 2020. This restriction will also apply to Ogun State due to its close proximity to Lagos and the high traffic between the two states. All citizens in these areas are to stay in their homes. Travel to or from other states should be postponed. All businesses and offices within these locations should be fully closed during this period. The governors of Lagos and Ogun states, as well as the minister of the FCT, have been notified. Furthermore, heads of security and intelligence agencies have also been briefed. We will use this containment period to identify, trace, and isolate all individuals that have come into contact with confirmed cases. We will ensure the treatment of confirmed cases while restricting further spread to other states. This order does not apply to hospitals and all related medical establishments, as well as organizations in healthcare-related manufacturing and distribution. Furthermore, commercial establishments such as A, food processing, distribution and retail companies, B, petroleum distribution and retail entities, C,